So there's been some talk about the symptoms of the latest COVID variant that the World Health Organization is looking at, the XBB.1.16 COVID variant. It's an Omicron variant. We are seeing at this time that cases in India in particular and other parts of the world are seeing a surge of this particular variant, and their cases are increasing. You guys might have heard that there have been some eye symptoms that have been noted along with this variant, and I wanted to kind of talk a little bit about this. I found a preprint. Actually, a colleague of mine actually forwarded me a preprint study done in India. It's a pediatric observational study that went to take a look at some of the presenting symptoms in children who had this XBB.1.16 COVID variant. There are a few things that this particular study found. Again, this is a preprint. It's not been peer reviewed, et cetera, et cetera. So this is all very preliminary, but I did want to mention this because you're probably seeing the headlines. So the study found that in the small group that it looked at, the pediatric group, that they discovered that this particular variant, what they suspect is this variant, is causing kind of a mild, brief, as they describe it, symptomatic illness in children. Most of the children who were affected had mild upper respiratory symptoms like fever, cold, cough, things like that, that would resolve between 1 to 3 days. But they also found, and in addition found that the disease was more prevalent in infants than in older children. And then this brings us to sort of the surprising finding that a lot of the headlines are taking, which is like these eye symptoms, right? Conjunctivitis eye symptoms. So one thing that they found, and the researchers in this preprint said that it was a surprising finding, not seen necessarily in prior waves of COVID, et cetera, was like this itchy, non-purulent conjunctivitis or eye irritation that was seen only in the infants in the study. Again, a small observational study and pediatrics, but this is what they're seeing. And it was 42.8% of the infants had this particular symptom. Again, it's one of the reasons why we are seeing the headlines like, hey, this XBB.1.16 variant could cause eye symptoms, et cetera, et cetera. That's why we're seeing this because of, say, this preprint and then other anecdotal reports. Doctors are saying, hey, I've been seeing these patients and this is what I'm finding. What I would say is that this is all still very preliminary, if you ask me, and there have been many anecdotal reports, meaning doctors saying, hey, this is what I'm seeing, which is very valuable. And then, of course, this preprint study, which is small, but we still have yet to sort of see how this is going to play out, see if we start to see more of that here in the States. Of course, the World Health Organization is still looking into this variant, the XBB.1.16 Omicron variant. So I'll keep you updated. Guys, I'm Dr. Jen, practicing family physician, honor, health expert, and video creator. On Facebook, please like and follow my page. For those of you who send stars, thank you so much. Consider joining my subscription group, guys. Also on YouTube, please subscribe to my channel. Click the little bell for updates. Guys, I'm Dr. Jen. We'll see you soon.